Here. Do a little testy test there.
1, 2.
Okay.
Good morning, everybody.
Good morning. Good morning. All right, Dr. Mike. Thanks for coming, man. I got it. I know your time is limited, so we're going to jump right into it. I've been a lot of people asking me to always give a quick intro, who you are, what the deal is. You correct me if I'm wrong. From Belgium.
Originally, that's correct.
Moved here in the 90s.
Correct.
You were the assistant and/or coach for the Olympic team.
For the Olympic swimmers in preparation of the Atlanta Games in 96.
Awesome. So far, so good?
Yeah.
And now you run and are a huge, you have your PhD in holistic nutrition.
Correct.
And you are one of the founders of the Neomatrix stem cell research and facility.
Mm-hmm.
And did I do good?
You do good. Yeah, awesome. You did work.
Yeah, man. So I really, really thank you for coming on the show. For those that don't know, you're local to Ormond as well.
Mm-hmm.
I am a huge advocate and believe in not only the stem cells, but your lifestyle. And I've been on you. I know you're a busy guy, so I thank you for coming. And what I'd like to do today is jump right into what this. I would say it's newer, but it's been around since the 70s ish. Right, because we've got, correct me if I'm wrong, but my novice way of looking, we have 3 types of stem cells,
mm-hmm.
and the one that we used to have was founded in the 70s ish, and now we've got the embryonic stem cells. And is that what we're? I mean, the floor is yours.
Stem cells. You're right. The mesenchymal stem cells were discovered in 1976 by Friedenstein and colleagues. And then, then initially it was the embryonic stem cells from the aborted fetus. Obviously, they came with many moral and ethical concerns. But those stem cells always have been illegal and still are illegal in the use of human applications. So they're only used in research. Then in the 90s, early this century, it was the first therapies were mostly based on harvesting the stem cells from our own body, either from fat cells through liposuction or the bone marrow extraction. And those procedures are still around, but I personally consider them outdated because, again, we're talking 1 to 2 decades ago.
Right.
And so today, the advances in stem cell therapy reach to obtaining those stem cells from birth tissue, either placenta or umbilical cord tissue, and basically studying all the bioactive molecules that those stem cells signal and excrete, such as exosomes. Exosomes right now are the topic of talk into the stem cell therapy arena today.
It's interesting you bring that up. Pardon me, because I have to bring this up. My grandfather, who is really into this whole segment as well, he wanted me to ask right off the bat, exosomes. So let's just jump on that right there. Now, what is it? What are we talking about?
Well, exosomes are not stem cells per se, but it's the stem cells that activate and signal, all kinds of bioactive molecules. And so it just happens today that that they are really doing a lot of research on those exosomes. The first manufacturers are on the market with those products. Obviously, they're not regulated by the FDA and things like that yet. But, because this is a fast-growing arena, even the FDA continues to be stricter and stricter, which, by the way, is a good thing.
Right.
Making sure that people are not taken advantage of, that people are treated only for conditions proven to be effective by scientific research, etc. So we're 100% advocate of stringent regulations and things like that. But, once things are approved or studied, meanwhile, newer things are already on the market, right? And so this is an ever-evolving, market is maybe not the right word, but science evolving so fast, just like our iPhones, right? You can't keep up. And it's the same with this. So exosomes is kind of the talk of the town right now. And we'll see where it goes, but it has a lot of promising,
the results.
Yeah.
Mm-hmm. So what I'm finding interesting is that, and for my own, once again, novice, and anything that I do say that may be kind of elementary, bear with me. But I got turned on to this whole segment by the Joe Rogan interview that he had with Mel Gibson and his father. And I was blown away. And once again, it seems like it's the field or whatever you want to call it, lack of better words, the market, et cetera. It's picking up. It's like the CBD thing, right? Like everyone and their mothers do the CBD. But the stem cells is so let's just talk about, from a novice standpoint, you're an average American, you're dealing with some ailments, whether it's chronic and or new. Who are some people that right now you feel that your heart's going out to them saying, like, listen, this would be an ideal situation for you. And I know that there are different varieties of like the way that it's rendered, for instance, right? Like you have the intravenous stem cell, and then do they call it like the location one? If it's something local. So if they're dealing with like a knee or a back or this, but what's like the common denominator of the type of patient and or person that's benefiting from this right now?
Well, first the global picture, and I'll tell you really which people are benefiting right now. But if you think about a stem cell, you got a sperm and an egg cell, right? They form really the first stem cell, and 9 months later we have what?
Baby.
A human body, right? So now today we're in an era where we could utilize a stem cell and introduce it back into the body and potentially obviously fix everything that stem cell made in the first place. But we're pretty much figuring out how to apply that knowledge or technology. But from a scientific point of view, and at Neomatrix Medical, we only treat conditions that have been proven to be effective with scientific evidence, peer-reviewed medical, published in peer-reviewed medical journals. You can find those on our website. But so there's 4 categories in the older population. Number 1, orthopedic conditions. So when it comes to mild to moderate arthritis of the hip, a knee, or any arthritis, regrowing cartilage is very effective. Unless it's bone to bone and really bad, it may require more treatments, or the results may not be as good if it's too far gone. Any soft tissue injury, a rotator cuff tear, a tendon tear, a ligament tear, a muscle tear, plantar fasciitis, anything that has to do with the musculoskeletal system and soft tissue responds very well and very fast. So any musculoskeletal, any orthopedic condition, if it's not too far gone, we get great results preventing many invasive surgeries, reconstructive surgeries, and replacement surgeries. The other area, which currently is our number 1 patient population, is neuropathy. A lot of people, older people, suffer with peripheral neuropathy, not only from diabetes, but many unknown causes that cause tingling and numbness and burning and swelling in the lower extremities, sometimes also the arms, but mostly the lower extremities, which then affects their balance and their gait, right? So they are unable to, do functional activities that they want to do, their hobbies, playing with the grandkids, those types of things, walking without a cane and a walker. So again, scientific literature shows clearly that the stem cells that we use, the ones of the umbilical cord or the Wharton's jelly, are effective in the repair of small diameter nerve fibers, which are causing those neuropathies, right? So that's our number 1 treatment right now, and many of our elderly are suffering with neuropathy, and so we have a solution for them. There's really nothing else out there for them besides some medications that may or may not help with the pain levels, right? So that's the second area, the neuropathies. The third area is sexual health. So we're talking about erectile dysfunction and those types of things. Many times they're treated with PRP, but our stem cell product is much more advanced or much more effective than just the PRP products. So when we talk about P-shot, O-shot for women and men, so that's a third arena basically. And then the fourth one that we see really good results, also backed up by scientific research, is eye conditions. So dryness of the eyes, dry macular degeneration, those types of things respond very well. So those are basically the 4 conditions that we treat at our office. Again, stem cells could potentially treat anything you can think of. There's a lot of good research showing that it has good results with autoimmune conditions like Parkinson's, MS, Alzheimer's, and the list goes on, rheumatoid arthritis, lupus. But those procedures today are considered off-label in the United States. Doesn't mean illegal, but off-label. So, at our offices, we just try to treat patients based on scientific evidence.
This is fascinating. So the people that you are, those primary areas are areas that you are not only an advocate for, but have the scientific research, you have success. And now when someone is rendered these stem cells, are we seeing, is there a really big variable in the actual success rate? Because I know some I've heard the time, the turnaround time, if you want to call it that, is always different depending on each patient and condition, correct? So like if someone's rendered these stem cells, it may take, it's not an overnight fix.
No, right? It's certainly not. The stem cell treatment, let's take any orthopedic condition. To get the full benefit of the stem cell therapy, it takes 3 to 6 months. If it's a neurological condition like the neuropathy we just talked about, it may take a little bit longer, 6 to 9 months, to get the full benefit. So yes, it's a gradual, repair. It didn't get damaged overnight, and it's gradual repair. But it usually requires only one single treatment.
Wow. that was going to be one of my questions. Was I know depending on the injury and or depending on the situation, sometimes additional treatments and or ongoing treatments are required. Depending on, right? Is that correct?
Yeah,
in some
but
cases?
in this case, really not.
Okay.
Once we introduce the stem cells into the damaged areas of the joint or whatever it may be, those stem cells go to work
right away.
And they go to work right away, excrete all the active bioactive molecules that they need to get the job done, replicate themselves, do whatever it needs to be done, and it's a gradual process. Now, there's many people that do experience a pretty fast, let's say a few days, few weeks after the treatment, relief. And that's because those stem cells also happen to have a very strong anti-inflammatory effect.
Okay.
But even though they may experience relief, that doesn't mean that the stem cells already fix the cartilage in that knee or the nerve neuropathy.
So that's what's interesting, because I've heard some of the side effects are like immediate feeling of you're feeling better because it's non-biased stem cell treatment, right? So it's not it's whatever localized.
Mm-hmm.
So you're putting this intravenous embryonic type of stem cell.
Not embryonic.
Oh, I'm sorry. My apologies.
No problem.
Okay.
No, just correct. Embryonic means from the aborted fetus, right? It's illegal. And it's good that you make that mistake, because most people, and not just people, are confused about this. So let's clarify this. A lot of people, but not only people, healthcare professionals and even our politicians, they like to dismiss the potential of stem cells in the future of medicine because they wrongly assume that all stem cells come from the aborted fetus. And that would be called embryonic stem cells, from the embryo or the aborted fetus.
Okay.
Now, first of all, that's totally illegal. It's only those types of stem cells with their moral and ethical issues and concerns, obviously, are only used in research today. They never have been used in human applications. So when we talk about stem cells from birth tissue, we're talking about placenta and umbilical cord, which is after birth.
I see.
And obviously, there's no moral or ethical concerns because normally those tissues are disposed of in the hospital.
Wow. This is amazing. So for those that this is amazing, dude. I'm blown away. So now, if when I watched that documentary or the interview with Joe Rogan, that doctor that rendered that was not based in the States. So if they're not based in the States, I mean that's when we start talking about these facilities that are maybe rendering those types of.
Yes. So the doctor you're talking about is Neil Riordan.
Yes.
Actually, we talked to him many times.
Wow.
He has a great book, and we're gonna meet him. Me and our vice president Donald Bass. We're gonna meet him when I'm back from Belgium in a few weeks in Dallas in his clinic. So yes, he had clinics, outside of the United States. The latest one is in Panama,
right?
And that's mostly because Shenzo, when we are able to effectively treat a disease condition, but it becomes illegal in the United States, but we know we can help people.
Right.
Many people say, well, I'm going to go outside of the United States and start a clinic there. So there's many physician groups, American doctors, that have, clinics outside of the United States so they can treat their patients,
right,
accordingly.
Well,
and so he's very effective with autoimmune conditions. He treats cancers and those types of things.
Now, is it okay if I do? I mean, I would imagine it's safe to say, Doc, that you're an advocate for a huge list of things that stem cells can do. But because we're in the States and because you want to make sure that you're rendering this regulated type of treatments, is it kind of killing you inside knowing that, okay, I'm treating for this little list, which in all due respect, it is a little list. I mean, I believe that it can do this kind of list. So is it is that what you're saying? Is a lot of the physicians and practitioners, like you were saying, listen, I'm a firm believer that I know it could treat X, and I can't do it here. But if we can go to Panama, or we go to a country that's not being regulated. Is it safe to say this is what's happening?
Well, obviously there's a right balance, right? You can go to another country, but the FDA is always concerned about safety and protecting the public. Well, I wouldn't say always, but let's keep that for another discussion, right? But that's supposed to be its job, right? So obviously, when we get into new therapies and there's not, enough, what I would say, specific research, because these stem cells, the stem cells that we use, they have been cleared by the FDA as being safe,
right?
And that's their major concern. But right now, there's not been any clinical trials that are done with a specific product for a specific indication, like they do with drugs, right? So right now, there's a very general application of it. It's called homologous use, which means replace bone with bone, skin with skin, connective tissue with connective tissue. It's a very broad application. Right. But to answer your question is, obviously it's exciting to know that peer-reviewed medical research all around the globe indicates the benefits of stem cell therapy with any type of condition. And you can find those research articles, obviously, on PubMed and those types of things. Right. So it's exciting to know that. But of course, here we're limited with the legal stuff and the FDA, etc. So what we're doing is number one, because the FDA is coming down on things and this is going to be regulated more and more, we want to stay ahead, a few steps ahead of the competition, and obviously don't go out of business, and do everything that we can to, number one, help the patient, but also protect the patient. And from another point of view, the Federation of State Medical Boards, they came out with a policy that was adopted in April of 2018 to protect the patient. But because when new therapies emerge and they become more mainstream, like stem cell therapies right now, unfortunately, many clinics, physicians, consciously or unconsciously take advantage of a patient who's desperately in pain, who's not be responding to conventional approaches. And so they play on their emotions with testimonials, maybe with some case studies.
Right.
And so they take their money and do a treatment knowing that the treatment may not help. And so I guess that's in every profession, right? Where you have people trying to cut corners and take advantage. So we're trying to be an advocate to make sure that we protect the patient. We only treat conditions that are be proven to be effective. We do an informed and a shared consent. We discuss the risks and the benefits. We make sure that they exhausted all conventional approaches. Right. For example, if you come in for your knee, did you have physical therapy? Did you have cortisone injections? Right. And if all those other things failed, maybe you're a great candidate for this. Right. So we do it the right way. We do it the medical way. We don't just treat things that, it may work, it may not work, right? But having said that, obviously, it's very exciting to know that, for example, in Korea, when somebody has a heart attack, they take a piece of the healthy heart tissue, put it in a Petri dish, add the stem cells to it, put it back in the femoral artery. Those stem cells find a way to the heart and build a whole new heart. Amazing. That's happening right now. Type 1 diabetes, very effective treatments for that with stem cells, but not in the United States.
Right.
I've sent people to Lima, Peru, where there's an American physician group, not Peruvians, American physician group that has a clinic there that, has really good results with Alzheimer's, Parkinson's, MS, etc. Right. We can really not, we can treat those things here, but not the way we should treat them. For example, like you mentioned, there's two types of treatments. For our orthopedic conditions, we go locally into the joint, into the rotator cuff there, under guidance of an ultrasound to accurately place the product. When we want to have a systemic effect for a systemic condition like rheumatoid arthritis, Parkinson's, MS, Alzheimer's, or stroke, we obviously have to put those stem cells in the system, whether that's IV or IM, into the muscle. But then we really don't know where they go, right? Because we can't track them. I do track my daughters, by the way, but we can't really track those stem cells, right? But when you're not allowed to directly inject an organ like a pancreas to treat diabetes, then you basically are just hoping that those stem cells will go to the pancreas and affect it positively. While in other countries, they would directly go into the pancreas, deliver the stem cells where they belong, and get great results. But that's illegal to do in the United States right now.
It's unbelievable. And here's another reason why you're sitting in this seat is because I know how you not only practice your own lifestyle and the holistic approach, et cetera, but if someone does come to you, you want to make sure that they're exhausting all of the other things that they're doing. So diet, maybe once again, their physical activity, they're exercising, making sure that they've tried what they have been, and if they're not exhausting that, you try to get them on a system, a process. And then once again, then when it comes time, you're doing this. Now, once again, for those that don't know, what are the side effects? Because from what I understand here, the side effects are like your hair grows a little bit more, your teeth get whiter, right? You know what I mean? Like I heard you may feel flu-like symptoms maybe for 24, 48 hours ish. Is that
well, first of all, there's different types or sources of stem cell, and based on the source, you will have different possible benefits and adverse reactions. Okay. So that's the first thing. Do you want to get into that a little bit?
Yeah.
All right.
If you do, I do.
Yeah. Well, on our website too, for the listeners, it's for free. Go to Neomatrix Medical, NEO Matrix, MATRIX Medical.com, and there's a section called 7 Key Questions. Okay. You can read it, or there's a PDF file. You download it, you print it, whatever you want to do, right? But those 7 key questions, those are basically questions that I believe any consumer, anybody looking into stem cell therapy or considering it or researching it like yourself should read. And not just read, but ask. When you go to a clinic, whether you come to our clinic or anywhere else in the world, ask those questions to make sure you have the right product, the right procedure, the right experience, you're not being taken advantage of, etc.
Right.
So those are 7 key questions. We can later on, briefly go over them if you like. But the first one is exactly what we're going to talk about, is where do the stem cells come from? That's the first question you always ask, because there's different sources. They're not all equal. Broadly speaking, there's 3 sources from humans, allogenic sources, which could be placental tissue, umbilical cord tissue, and embryonic tissue.
Okay.
Or we could try to harvest those stem cells from the patient's own body. Adipose tissue, fat tissue, or the hip bone or the bone marrow from the hip, right? So that's kind of 5 sources. Now, each of them have advantages and disadvantages. Okay. The first one we already briefly discussed, those embryonic stem cells from the aborted fetus, right? First of all, there's moral and ethical concerns. They're illegal anyway, so it's a moot point to talk about because nobody can use them or will use them. They're only used in research, right? The second one, obviously, is trying to harvest those stem cells from the patient's own body. Now, that were the first type of stem cell therapies that came to fruition in the 1 to 2 decades. No, not in the 70s. That's when stem cells were. But when we started to actually treating patients, we're trying to harvest them from the bone marrow or from the fat cells. And, to me, they're outdated procedures. Unfortunately, many clinics are still doing them. But they come with many disadvantages. I can give you the top 5. Number 1, the patient will have to undergo a surgery, unnecessary, a painful liposuction to harvest the stem cell from the fat cells, or a painful bone marrow extraction from the hip. Not only could it be painful, but based on your age, there could be a long recovery time, and it's totally unnecessary. Number 2, and we can talk about that too later, yes, we need stem cells to repair tissue and re-engineer it, but the stem cells, they need the help from other essential components in the body to get the job done right. And so when we do these adult stem cell therapies and harvest stem cells from one area of the body and then basically relocate them or re-inject them into your damaged area, another area in the body, all we're doing is relocating, but we're not adding the other components, or the other components that are essential to get the job done, they may be missing. And therefore, the results many times are disappointing. Number 3, this procedure never can be standardized. There's no uniformity. There's no quality control. To explain that, let's say you come in tomorrow, and let's say we try to harvest stem cells from your hip bone, right? After we harvest them and do the surgery, under the microscope, we will see a certain quantity and quality of your stem cells, right? Now, let's say an hour later, your best friend comes in, and we do the same exact procedure. We'll look under the microscope. Is the quantity and quality of his stem cells the same as yours?
No way.
No way. Never will be. So that's what I mean. It cannot be standardized. There's no quality control. There's no uniformity. So therefore, the FDA in November of 2017 put out a notice to all those people practicing these types of stem cell therapies, discontinue in 3 years. So they got about 1.5 years left till November 2020, and this will become kind of illegal to do because it can't be standardized. But besides those 3 disadvantages, for the listeners, number 4 and 5 are the most important ones to understand. Scientists agree that as we age, the quantity or the amount of stem cells in our body drastically declines. Not only the quantity, but also the quality. What does that mean? Their ability to heal, to repair, to get the job done, to differentiate and replicate declines. For example, in a newborn, every 1 out of 10,000 cells is a stem cell.
Wow.
Okay. But if we're 50, 60 years old, it's only 1 out of 2 million. Okay. So the amount of stem cells in our body drastically declines. Also the quality, their ability to do their job. So that's the most important to understand, because now if we're going to harvest, let's say you're 60 years old and you want to get your knee repaired with stem cells, trying to avoid, for example, a knee replacement, right? If you harvest those stem cells from your own body and we look under the microscope, first of all, they're not going to have enough stem cells harvested through that surgical procedure. That's why when you go to those clinics, they will tell you to wait 4 or 5 hours. Or come back later that evening or the next morning. Why do they need all that time? Because they don't have enough stem cells to do the treatment. So now they're going to culture them in their laboratory setting, meaning they're going to amplify them, multiply them, synthetically, because they need more of them to do the treatments. But even if they increase the quantity, do you think it increases the quality?
No way.
No way. So research shows that the quality or the effectiveness of one native cell, original stem cell, equals that up to 1,000 cultured cells. So it can be up to 1,000 times less effective. And that's what people need to understand. There's many disadvantages, not just to surgery, but you will be relying on your own stem cells, which are low in quantity and quality. And even if they amplify them, the quantity, you still have a low quality. So it's an outdated procedure. It's certainly not the best way to go.
Right.
Okay. So, so the other sources of stem cells that we use are those from birth tissue. Could be placental tissue or umbilical cord tissue. And when we look at those types of tissues that are harvested, obviously from healthy birds in U.S. hospital only, they go through procurement, processing, manufacturing, cryopreservation. We can go in details there too if you like, but it's a whole process. But the question at the end, because there's many manufacturers of those products out there.
Right.
For us physicians to look for the best product for our patients, we have to ask one important question. How many live, keyword, stem cells are there in the product you're going to inject me with? I know there's many live stem cells in the umbilical cord, but how much time has passed and how much processing manufacturing has occurred? And now the question is, when I'm a patient, I'm getting injected, are those cells still alive?
Wow.
And many manufacturers didn't put in the money to submit their products or their end product to third-party laboratory testing to verify the viability of their product. So we can verify between 1 and 1.2 million live stem cells per cc in our product.
And you're making sure that this has happened through your...
Yes, correct.
This is so fascinating. So here's what's interesting about when they're being rendered. I mean, if I were like right now, let's just say I'm not a candidate right now because I'm not dealing with anything. Is it legal for me to have a facility extract my cells or something now and then like have them saved, or is that like sci-fi?
No, it's certainly not sci-fi, but why would you, again,
true,
why would you extract your own stem cells knowing that they're lower in quantity and quality than coming from birth tissue, right?
So this is what's interesting. So right now you're saying that, and I think I've heard a lot of people, even actually some of my own family members, have had that type of care rendered where they, once again, they're using yours, they're doing something to it, and they re-inject it, and it didn't work. That for a fact. Now that's my I've seen that firsthand.
Sometimes they work, sometimes they don't, because there's too many factors that you can't control with that procedure. Like I said, the quantity, the quality of your own stem cells, the other essential components that are necessary to repair something like growth factors, cytokines, scaffolding, those types of things we can't control. So it's basically, hoping that you get results with those types of procedures. With our procedure and our product, we can quantify and we can verify the amount of live stem cells, but not only the stem cells, we also know the amount of growth factors, cytokines, and scaffolding, the other components that we need are in that product. So when we inject these high quantity and high quality of live stem cells into your body, we're not counting on your stem cells. We're not counting on your healing capabilities. We're not counting on your health status right now or your medical conditions. We're introducing everything that those stem cells need to get the repair job done.
And one of the most important things is it's non-invasive. You don't have to do that, the surgery and extract the cells.
Correct. It's one treatment, a few injections into the damaged areas, and that's it.
It's unbelievable, man. It really is. And what are you? I could feel the passion in you. What are some of the things that you're dealing with across the board as far as some adversity you're dealing with? I mean, I can say without a doubt, ignorance is a big one, right? Like just off the bat, like, oh, you're killing babies and taking their fetus, right? Like that's probably one of the
that's not happening, as you already know, right?
Right. Well, of course,
those stem cells are not used in these types of therapies.
Right. But what could we do? Like, what is it that we could do from a, let's just call it an amateur standpoint. So like, for instance, like me, I'm the 30-nothings, still very active in a sports scene, etc. And now that my fellow players and friends, as we become more injured or this or that, you're a huge advocate for, I loved your hashtag. It was the no surgery movement. I mean, dude, I'm all about like that is, what are some of the hot items right now that if someone's dealing with things that are like usually the medical fields first go to, like for instance, is it like an ACL or this or that people are usually like, listen, surgery, boom, like they don't even, like the typical.
Sure.
What are some
well,
of these?
when we started first doing this about 4 years ago in Ormond Beach, obviously, a lot of my friends are physicians or are in the healthcare profession, and obviously they just like to dismiss it, right? But today it is becoming more and more mainstream. So I would say, Chenzo, there's two types of physicians or doctors or healthcare professionals. There's the ones that don't want to know anything about it, and they will continue to dismiss anything that's not in their own toolbox.
Okay.
And unfortunately, in my opinion, those doctors do not care about their patients, right? And then you have the physicians that do care about their patients. And so when something becomes more mainstream and more of their patients are asking or inquiring their doctor about it, they reach out to people like us, or they do their own research and they get more and more educated so they can have their, they can have an answer for their patients.
Right.
Whether it's the right solution for them at that point in time or not, I don't know. But we have those types of physicians right now. And actually, we have a free education program for physicians right now on our website. We're reaching out to them. We're working with more and more local physicians, obviously those that do want to know more about it.
Right.
Because these types of therapies, obviously, again, they're certainly not a cure-all. They're certainly, don't get me wrong here, but they could prevent or postpone at least many invasive surgeries in the older population. They have a very strong preventative aspect to it, these procedures, because what these stem cells do, they rebuild and re-engineer, right? So it's about turning back time. You mentioned yourself being active, getting a little bit older, sports injuries. So up until now, we talked about this older population with the orthopedic problems, the osteoarthritis, and the neuropathies, and those types of things. But for example, I get 2 cc's of my own product every 6 months. It's more preventative. I'm not treating any disease. I'm not in any pain, but I'm going to be 48 this year, right? So, and I'm swimming a lot. There's a lot of inflammation. There's a lot of breakdown of muscle tissue when we work out. Many times it takes decades for somebody to get diagnosed with some disease. So we know there's something brewing in our bodies when we're in our 40s, right? So putting those stem cells in our system is an anti-aging type of approach, but also preventative, because you continues to rebuild tissue that is breaking down. We are just aligned ourselves with the WSA, the World Sports Alumni, which actually is in Central Florida. And they have a few hundred, obviously, mostly retired NFL players, NBA players, tennis players, world champion boxers, and things like that. You should look them up. It's pretty cool, WSA. And so we are getting them engaged now, because a lot of those athletes, they all had injuries, right? And they're still suffering from the injuries, even though they're not playing anymore. So instead of going through the typical surgeries, using these stem cells to rebuild some of the cartilage, repair rotator cuffs, elbows in the pitching, those types of things. Very, very effective, because they respond very well to soft tissue injury. But even active players, we are treating in some of our affiliate offices across the country current NBA and NFL players. We can't say the names.
No, of course.
The reason why that is because apparently that's what I was told, their value will go down, because then they know they have an injury they've been treated for, right?
Wow.
But anyways, the reason why that is let's say you are a pro player, and during bye week or off season, you preventatively get your major joints, or muscles or tendons, the ones that you use in your sport, injected, and you repair and renew them. What you're doing is you're not accumulating that micro trauma and suddenly be injured. You're always renewing and refreshing. So we can extend the career of any sports person by years many times. And for them, that's millions of dollars.
Yeah. So here's what's interesting is that I'm sure we haven't checked any of the comments, but I bet you a lot of people, because I had a lot of my friends and family ask me too, do you see that the reluctancy of maybe mainstream medical practice is not doing this because this really weird, we know that it's happening where the physicians and our practices are being given kickbacks by pharmaceutical companies to render services and all that jazz. And I don't want to get into that because that's a whole nother kick-a-boodle, but as we're becoming more and more educated and we're learning, are you seeing that a physician and or a practitioner, maybe not, there's no kickback, this is just purely for the care of the patient. There's no fiscal gain, and there's no, right? So do you think that maybe that's why it hasn't caught on as well as it has? For instance, you and I could walk into a physician's office today, say my elbow hurts probably before I finish my statement. I'm on some type of synthetic drug and maybe a already game plan of having some type of surgery very soon. And that's probably less than 5 minutes, and the guy not even looking at me in the eye.
Yeah.
Now, we know that there's that systematic process in place. Why or how it's gotten there, let's not get into that. But do you think that the reason why guys like you and your practice in general are not being on the tip of the tongue is because there's not that kick, like behind the scenes?
Well, obviously, like you said, we can get into the big farming and the manipulation, and that's another whole hour, right? And I'll be glad to do that too, with my opinion, not necessarily all facts, right? But what I do know is that, again, I would say that the more progressive physicians, the younger physicians, the ones that do care about their patients are starting to look into it, because you cannot ignore it anymore, right? And it will get bigger and bigger. And there is plenty of research, because people always ask me, is this still experimental, these stem cells and stem cell therapies? And the answer is no. If you look at the research, for example, because that's what doctors assume too, that it's still experimental. If you look at the research right now, there's different types of stem cells, right? If we only look at the top one, mesenchymal stem cells, and disregard the research on all the other types of stem cells, we're seeing that there's more than 4,000 medical research articles are published in peer-reviewed medical journals per year. Now, that's more than 10 a day, which, by the way, is far more than any other topic in science or medicine.
Wow.
Okay. So there's plenty of research, right? Real research, not hocus pocus clinical trials, real research on this. Because, even if you look at the February issue of 2011 of Time magazine, the cover will say in big letters 2045, the year of singularity. Very complicated term, but to simplify it, it's immortality. Doesn't mean we live forever, but what it means is we can, as humans, be 140 years old and live quality life, not having to suffer. Right. And that's possible. So we all got to stay, by the way, listeners, alive till 2045. But there's scientists agree that the stem cells are the future of medicine. So for all our doctors and healthcare professionals, they can try to keep ignoring it, but it's going to take over. The reason, though, and in all fairness, they have been obviously trained in medical school, which is sponsored by the big pharma. And like you said, it's a protocol. It's something they follow. First a drug, then a steroid injection, then a surgery. And that's their toolbox. And so these stem cells are obviously not in their toolbox. Another thing that I think you probably want to hear is that when we were in the 80s, 90s, let's say you have a certain medical condition and a possible therapy or drug or solution for it. The average, and this is not an opinion, this is the fact, the average time it would take to get all through the clinical trials and then conventional or commercial insurance or Medicare to actually cover it for the regular Joe was 23 years. Okay. Now, today, not only IT, remember the phones we talked about before the show? I got to ask my daughters, how does this work, right? I can't keep up everyone. But it's not just IT, it's science and medicine evolved so fast and exponentially that we don't have 23 years to research something. A good example is the Cleveland Clinic, right? Very renowned, the best at what they do. I'm not going to argue that at all. But if you would go to their website right now and click on stem cell therapy, guess where they get their stem cells from? The hip. The bone marrow. Wow. And I just told you it's outdated. But they started doing research as soon as the stem cell therapy, started, which is between 1 and 2 decades ago. And they're going to finish up those studies soon. And they are the best at that procedure. But I wouldn't want it anymore because it's already outdated before it has been proven, according to our terms, FDA approvals and those types of things, clinical trials, effective. So, we can research how fast a bicycle is on the road, but by the time we figured it out, there's a Lamborghini to ride. Who's going to get the bicycle? And maybe it's a silly analogy, but that's how fast things are evolving. And so with the way in this country we do research and the time it takes and the money it takes for companies to do, we'll never catch up.
This is so crazy. So let's play devil's advocate for a minute and act like the people that, now I personally haven't run into any of them, and I meant that. And I can't mean that more sincerely, because my motive was 100% pure getting you on the show, because I'm a huge advocate for it. I've researched it from once again, novel standpoint, not as much as I probably should, but also looking into it for my own treatment and my family's treatment. But let's play haters right now. What are some of the top, excluding the ignorance, the embryonic and, you're getting them for babies and the ignorant side, what are some, who could actually give you a decent run for your money in an argument per se. Is that even exist right now, or are they like, have they lost their ground, or can someone actually say, is there any grounds for argument, like maybe a potential listener or someone who's actually advocating against this? Are there people advocating against this? That's my question. Ultimately, are there?
Well, usually the ones that are not offering the service, the ones that are losing business because of it, for sure. But also I will also would say the ones that are set, that have their mindset in the conventional way of doing things. For example, when we're looking at a regular doctor who prescribes prescription drugs every day,
right?
A prescription drug is FDA approved. That's the terminology that they use, right? But other products and other equipment, according to the FDA, is regulated in different categories and different sections. For example, dietary supplements, right? Are they FDA approved?
Negative.
No, they're regulated a different way. Not very well, by the way, but they're very regulated a different way. Now, all these stem cell products today, they are regulated under a different category, a different sections called Section 361, human, cellular, tissues, and products, right? And that's where they're regulated. So again, it comes down to ignorance again, because a doctor will ask me, well, is your product FDA approved? Well, we're talking about a human tissue and cells. They're not considered prescription drugs, so they don't have to be approved. The FDA has different regulations for that, right? And so what listeners need to do when they look at a stem cell product, or what they should ask, is number one, where is the FDA registration? The product we use is registered with the FDA. That way you know it's not made in somebody's garage,
So quick time out, though. That's a huge point. So if someone's pursuing this services, hot topic to ask any practice or doctor is saying, is the actual
product that you use registered with the FDA?
Okay, amazing.
That would be a question. And then the other question is the manufacturer 100% compliant with Section 361, right? Human, cellular, tissues, and products. When you're a consumer and you go into a clinic and they say their product is FDA approved, that's when you need to run, because they don't understand that it's not a drug. It doesn't even exist. And, they probably will get in trouble with the FDA soon anyways.
But they're just saying that because in all due respect, from what I've seen, once again, from a novice standpoint, that stem cells it's just like with the CBD world, even though they're two different realms, but it's the health and fitness, health and wellness segment. Forget about it. Everyone and their mothers are, so you get CBD in your tea now at some, you know what I mean? But here's that hot question too. You've got, is it regulated by the regulation company, the 30, what's it going to get the number 301 or something?
361.
But one of the things you had also said too, is asking them how many the word cultures isn't applicable, I'm sure.
Live mesenchymal stem cells are there in that end product.
Now,
if you want, I can go over the 7 key questions. I mean, I put together a document, and you can find it on our website.
Well, yeah, I don't want to. If it's on there, I'm more. Here's what's. But let's say I'm in the office, right? And they start to if that's not well received from the whatever it is, a nurse or wherever's talking to me,
you need to walk.
Just leave. Yeah. Right. If they're like, and I mean, would you be an a-hole if you actually are like, hey, I want to see this paperwork, or I want to like.
No, during our seminars and in the 7 key document that we have available for the consumer on our website, we tell them which questions to ask. And with subsequent questions too, based on what the answer is,
right? Because
we want to educate the consumer out there. Again, it's like in any profession, right? You got good plumbers and bad plumbers. You got good chiros and bad chiros. And with the stem cell industry too, you have to be careful, because it's not covered by insurance, and so many people are taken advantage of emotionally because they're desperate. They're in so much pain. Right. Conventional approaches has not helped. So we create with the document, in our seminars too, we create awareness to make sure that you're not being taken advantage of by paying a lot of money for a treatment that's not been proven effective, or they just show you 3 testimonials, but that's really not research, right? So it's creating awareness and educating the patients on what questions to ask. And like you said, one of the questions is, are you 100% compliant with current FDA regulations? That's question number.
Compliant is the key word.
Yes.
Not ready.
But to go back to your initial question is what are the objections? Is the conventional medical practitioner assumes that because these products are currently not FDA approved, which they never can because they're not in that category, that it's bogus. What they don't understand is the vast amount of research behind it, much more research than the drug they prescribed yesterday to their patients, number one, and that the research is valid research, published in peer-reviewed medical journals that you easily can find on PubMed, and that the FDA regulates these products much better than dietary supplements, by the way, and that they continue to regulate it, right? Mostly from a safety point of view. Right. And then you have the Federation of State Medical Boards, because more and more practitioners, whether they are doctors or DOs or MDs, etc., they are starting to do those therapies. So the medical boards, they get complaints and they don't know what to do with it because they don't have any regulations. So now they adopted a policy mostly to protect the patients going to those doctors who are giving those services. And so we are advocates at Neomatrix Medical of that policy, making sure that when we treat a patient, that they qualify, that the condition that we are going to treat with this product is proven to be effective in clinical research, that the product that we use is registered with the FDA, has live stem cells in it, and has everything in it that we say that it does. Because if research shows a certain stem cells work for condition A, but we use a different product or not with live stem cells, then obviously it's not going to work, right? So I just urge everybody to we do seminars all the time. I got one this afternoon in Daytona Beach, 1 o'clock.
We'll be posting the links to the stuff.
Yes, we have seminars all the time. They're for free. They're about 75 minutes. You learn everything about it.
My grandparents went to them.
You can ask, you can ask questions as much as you want, or if you don't want to come to a seminar, again, 7 key questions on our website, excellent documents.
Let me ask you this too. When someone has aggregated these 7 questions and presents them to them, I know this number's got to be very arbitrary because it's got to be growing as this industry is growing, but what would you say is a safe percent of, lack of better words, the bullshit? Like the facilities that once you do ask these questions, what's a safe number that you think, is it more than 50% of the facilities? Is it,
I would say that far more than 50% of the facilities will fail to answer one or more of those 7 questions. Sure.
So that's where now I can, once again, no joke, being here with you is so powerful because I can sense your passion towards it. And that was another question that you already answered inadvertently, I was going to say, do you take this, it's almost like dietarily. You're saying once every 6 months you do 2 cc's?
Well, yeah, I do 2 cc's, which is between 2 and 2.4 million live stem cells.
Okay.
Because 1 cc is between 1 and 1.2 million every 6 months, more preventatively, right? But I did have last summer, 2017, when I came out of the swimming pool doing the butterfly event at the U.S. Nationals in Minneapolis, I know something was off with my shoulders. Next morning, I couldn't lift my arms. So I came home. I didn't swim that day. I was diagnosed with 2 full-thickness rotator cuff tears in my left shoulder and the exact same 2 full-thickness rotator cuffs in my right shoulder. Normally, that's surgery. Obviously, I didn't opt for surgery. Guess what I had done?
I bet stem cells.
Stem cells. And again, 8 days later, I had my full motion, but obviously the physician said, don't go swimming yet, don't go to the gym yet. So I had to take 30 to 60 days off to not re-injure it.
Right.
But when you look at the before and after imaging, we do imaging too. So it's not just like I feel better, I don't feel better. We have before and after ultrasound imaging.
Okay.
So not only did those 2 rotator cuffs in each shoulder, the supraspinatus and subscapularis, get completely repaired.
Wow.
But what people don't understand too is, and on a seminar we show a lot of before and after imaging.
Right.
Not testimonials, not subjective pain scales.
Right.
Imaging. Here's the tear. It's so many millimeters thick, and 5 months or 3 months after the injections, look, it's completely repaired. No tear anymore. So, but stem cells not only repair, they renew and re-engineer. What that means is anytime you repair something, this tissue now is much thicker, much stronger, much more resilient than even before it got torn.
Man, so was that your first time ever kind of treating an injury versus it being just the term dietary?
Yes, correct.
And you saw
amazing
results.
Well, I'm leaving for Belgium on Tuesday in a few days to try to attempt an American and world record with a broken shoulder that won't work.
Oh, you got right now? It's still hurt?
No.
Oh,
no. It was torn, right? Rotator cuffs were torn, but they're all repaired. And I've been training pretty hard, so I'm ready.
So you're doing this, and now are you doing the muscle or are you doing the intravenous when you're doing your CCs?
I do IM or intravenous, so it gets into the system. Now, when we do the IV, those stem cells have been tracked, in the past. So when we put stem cells in your vein, they go where first? The lungs.
Okay. Oh, wow. Interesting.
So what we have seen is we get great results with any lung conditions like COPD. Again, it's off-label. We can't market it.
Right.
We can't advertise it because it's considered off-label. But those people, respond very well and very fast with one treatment just because that's where the stem cells are kind of.
Is asthma in that category?
Yeah, anything that is
cardiovascular.
Yeah.
Wow. So this is just unbelievable. And by the way, I know we got to keep track of the time because I know you got to roll. You got like 10 more minutes, maybe?
Sure.
Give or take. So you, now the people that are working at the facility too, have you seen that? Most of you guys are practicing what you preach and you're taking this. Is once every 6 months kind of like a normal, like, was that something that would be applicable to me where I don't have anything chronic. I'm not necessarily.
Yeah, that would be a good thing. Of course, you could do it more often. There's no contraindication, but it's not cheap either. Right.
Right.
So we're not.
Can we talk numbers for?
Yeah, sure.
Because I looked into it.
We are transparent. We're full disclosure. We have competitive prices. If you compare apples with apples, again, there's many types of stem cells out there.
Right.
You can talk about CCs, but who wants to pay for saline, right? So it's the number of live stem cells you're paying for.
Okay.
And things. But yeah, we'll be glad to.
I don't mind talking some numbers because I looked into it, but it is obviously it's not something covered by the insurance, and we won't go there why it is or isn't. But it's not
23 years. Yeah.
Isn't that ridiculous?
No, probably from this moment on. The most optimistic physicians or people in this industry knowing about insurance think it's going to be, 7 to 10 years. But again, to me, it's irrelevant because in 7 to 10 years, me and you are talking about something totally different.
Right. It could be a new,
and this will be outdated.
Like a light
and this will be
therapy
outdated.
Right.
So,
man. So, but if somebody wanted to, let's just not talk about certain situation. Let's just talk about someone that just thinks it's going to help them. Maybe something that's once again not life-threatening, but you're talking about 2 cc's or 2 treatments every 6 months of 2 cc's. Give me an idea. What can an average person listening that wants to implement this into their lifestyle?
Our smallest vial is half a cc.
Okay.
Then most people use 1 cc when it comes to a shoulder, a low back. If we treat a low back, a shoulder, a hip, a neck, usually we need 1 cc of product. 1 cc retails for $6,450.
Okay.
If you need 2 cc's, the reason I take 2 cc's is because I can get it a little bit cheaper than everybody else.
Of course.
So I take the higher vial, but 2 cc's retails for $9,995.
Okay. So, and that's is that a one?
Yeah. Now this, I do that preventatively, right? But let's say you come in because you have rotator cuff tear or you hurt yourself, doing your sports, right? And we need to treat your shoulder or your knee. Most of the time, the physicians will require 1 cc. That's $6,450. Now, by the way, if you come to our seminar, you get $1,000 off. So most people get it for $5,450. They get a complete joint treated. And that's only 1 treatment, though. So you don't have to come back and spend more money to get another injection, right?
Right.
So that's the advantage. It's only 1 treatment. You don't have to keep coming back. So yeah, it's obviously, especially right within the Daytona area, fixed income. It is a lot of money, but it does change a lot of people's life for sure.
Well, look, Doc, I can't thank you enough for coming once again, and I'm going to put all the links on here of the practice, and I wish you much luck. So you bounce into Belgium when?
Tuesday morning I'll leave. I'll arrive there Wednesday morning, and then I'll swimming next week, Saturday. I'll try to attempt American records, and a week after a world record.
Which race?
100 meters freestyle.
Yeah. Who are you going against, Phelps, or who has?
No. Well, they're a little bit younger, my friend, and much faster. So I'm trying to get the records in the 45 plus.
Yeah. Who has it right now?
Right now, Paul Smith, a guy from Texas who swam the record in 2009, but he was 6'6", I heard. So
it's his time.
I'm short a few inches on him. Yeah.
Nice, man. Well, like I said, is there anything else that you want to? I know you're a busy guy. You want to throw in there? Aside from you got a seminar today in Daytona.
Yes.
How often are these seminars? Are these once a month or are these once a week?
In Daytona and Palm Coast, we're every month.
Okay.
Usually 2 or 3 days in Daytona, a day in Palm Coast. But we also travel up to 2 hours away from Ormond Beach.
Okay.
So we're in Jacksonville, the Villages, in the Augustine, Melbourne, Gainesville. So we do seminars too. But check our calendar. It's on our website. And you always can check where the seminars are. But every month we have a few in this area.
Awesome. Well, Doc, thanks so much for your time, man.
You're welcome.
I appreciate
Thanks a bunch.
Dude, that was, I loved it. I'm sorry, like I said, thank you so much for your time because I know you got, but holy shit, you're amazing. Amazing.
For hours. hours. Huh?
I know. Well, dude, that's what I'm saying. Like, it's my first time ever going on a Saturday, but we'll see. I had a lot of people that were super pumped.
Anyways, right?
Yeah, it's recorded now, so we'll be good. And what I'm doing is once they're recorded,
put it on my Facebook too.
Yeah, 100%.
I don't like to post things myself, but if you put it there, then people may listen to it later. We can use it too.
I mean, we're gonna. So most of them are getting, like, some of my best ones were already at like. I had like 4,000 on one of them, but it's backyard. Everyone who's watching this is like literally right here, you know?
Right.
And like I said,
That's where I am. Right.
I hope you super success, dude. And I'm still pursuing
and if you want to talk about other things or once in a while an update.
Dude, I would love, like I said, I don't know what
CBD, I do CBD seminars. I'm not involved with it, but people hire me and pay me to talk about it.
Well,